today, 11th March, is a very important and grim day, in a way, grim day for all of us. It's third year of the pandemic, many confirmed cases and deaths, officially. We know the numbers, 6 million deaths. This is an underestimation. And we know that for a fact, the cases and deaths are so much higher than that. A study released yesterday estimates that 18.2 million people have died worldwide because of the COVID-19 pandemic. This is by the end of 2021, and many of this in developing countries. It's not just the number of deaths, but the social and economic effects of COVID-19 continue to be disastrous, especially for developing countries. And the impacts are really wide-ranging. It affects livelihoods, health, poverty, nutrition, education, violence, and the developmental costs, massive. And I just want to throw out some statistics, because the statistics show us, what we are actually facing with the COVID-19 pandemic. We have 38 million children worldwide lacking schooling. And it's projected that 11 million girls will never return to school following the COVID-19 pandemic. We know the poverty has increased by 97 million, and perhaps this is even an underestimation. We definitely know that progress towards ending poverty has totally been lost. 100 million more children are living in multidimensional poverty without access to health services. The 2021 report of UNCTAD notes that the damage from COVID-19 crisis has exceeded that of the global financial crisis in most parts of the global economy, and it has especially been draining on the developing world. Now, the good news is we have the medical tools and the products to deal with COVID-19, to manage its effects, to facilitate recovery. Many of these products have been developed with significant amounts of public funding, but the bad news is these products are not available, not affordable to many developing countries. As pointed out by the Director General of WHO, vaccine inequity and health inequity overall were the biggest failures of last year. Now, since the beginning of the pandemic, 2020, we have known that achieving equitable access will be one of our biggest challenges. But we were comforted because we heard calls of global solidarity globally by European Union, Germany, France, many countries. They spoke of universal access, global public good. So many of us were very optimistic that globally everyone will do what it takes to get there, including removing intellectual property monopolies, rapidly sharing technology, know-how, so that manufacturers all around the world can be engaged in production and supply. The access challenge is massive, so we will need manufacturers everywhere to be engaged. But this has not happened. What we have seen is actually artificial scarcity, prioritization to a lot of the higher income countries. It's really witnessing 2 years of just shameful, inequitable access to vaccines, diagnostics, and therapeutics. We have not met the vaccination targets. WHO has targeted 70% by June 2022. The last I heard, I think about more than 100 countries are off track. The uptake of third vaccine dose is quite low in developing countries, though this is recommended now by WHO and SAGE. We do not know what is going to happen to new generation vaccines. Are we going to be having access? Several of WHO's very important recommended therapeutics are neither available nor affordable in many developing countries. And let's not even talk about the disparity in access to diagnostic testing. Is very, very low in many developing countries. And we don't even know what kind of variants are circulating as a result of the low testing and the rate of infection in many of these countries. Now, in 2020, South Africa and India presented a proposal to waive certain obligations of the TRIPS agreement. And the aim was really to diversify production, expand supply options. Now, WTO rules allow for such a waiver in exceptional circumstances. So the proposal is not unique in that sense, because we know that WTO has many precedents where waivers have been granted, including with respect to intellectual property. And the waiver proposal has received extensive global support from IGOs, NGOs, academics, IP experts, Nobel laureates, Vatican, the Pope, and many, many more. The proposal is now co-sponsored by 65 WTO members and supported by many other WTO members. Despite the huge support the proposal has enjoyed, in 2021, developed countries, the European Union, UK, and Switzerland in particular, opposed the proposal. We have seen many efforts to delay, to distract from the proposal, and even a refusal to engage with the text proposed by the co-sponsors. In May 2021, we were all delighted because US announced its support for an IP waiver, although it was only for vaccines. We thought that we would see a change. And US has since repeated this several times, but we have not seen much else. By the end of 2021, it became apparent that there cannot be a credible WTO response to a pandemic without a meaningful outcome on the TRIPS waiver and addressing intellectual property barriers to access. We are now at a major turning point. We know that timely access to affordable COVID vaccines, diagnostics, and therapeutics is key to managing the effects of COVID-19. It is key to socioeconomic recovery. And yet these tools are out of the reach of many countries, many developing countries in particular. The question is, will WTO deliver a bold, a meaningful TRIPS waiver? Now, recently we have heard senior WTO officials say, no one side will be happy with the outcome. But the test really will be whether the outcome will provide freedom to operate an additional policy space without having to deal with procedural legal uncertainty, various IP requirements on a product by product basis. Whether it will positively facilitate entry of follow-on manufacturers and expand timely and affordable access. Recently, more than 200 civil society organizations sent a letter to the WTO DG highlighting key aspects that should guide consultations and negotiations that we understand are presently ongoing at the WTO. So against this background, I'm very happy to introduce a very distinguished panel of civil society experts. Brooke Baker, Professor of Law at Northeastern University, as well as with healthcare. Laurie Wallach, Director of Rethink Trade in US. Lina, MSF Access Campaign in South Asia. Felipe, Project Coordinator with Brazilian Interdisciplinary AIDS Association in Brazil. Othman Maluk with IP, the IP and Access Lead with International Treatment Preparedness Coalition based in Morocco. They have many years of expertise in the TRIPS agreement, but more importantly in access and in addressing and dealing with intellectual property issues, in ensuring greater competition with respect to affordable access. So we hope they'll provide their views on what the TRIPS waiver outcome should be or should not be. And the panel will discuss two main aspects. The first is the scope of products, and the second is the scope of IP. And time permitting, we may take a few questions. So I wanted to begin with the scope of products. The aim of the TRIPS waiver proposal is the prevention, treatment, and containment of COVID-19. And so the proposed scope, as proposed by the waiver co-sponsors, covers all medical products needed for this purpose. Recently, the WTO DG and the DDG have indicated that what is being discussed in the consultations is about vaccines, with a second track to address diagnostics and therapeutics. Presumably, I don't know, at a later stage, and I guess this is because of the US position. The US says they support an IP waiver for vaccines. But we also know from previous experience that WTO, even if there are firm timelines and commitments that have been agreed to, and however obligatory they may be, often a lot of these are not followed through. So we could say, we will do diagnostics and therapeutics later. I do not know when the later stage is because we need it right now. We also know if there was a later stage determined, it may not happen. So I guess the question I have for Othman, Lina, and Felipe, how important is it to ensure that the scope of the outcome is not just about vaccines, but also at the very least covers therapeutics and diagnostics. And this need to be addressed together with vaccines. So I just want to note that this is already a significant reduction from the original proposal of the co-sponsors. As I mentioned, it covers a wide range of, it covers all the medical tools that will be needed for the prevention, treatment, and containment of COVID-19. So I wanted to start off with Othman, if you would like to share your views on this.
Thank you, Sangeeta. Good morning, good afternoon, good evening, everybody, depending where you are. I think this is a forced debate. If you ask first-year medical students, they will tell you that if you want, let's say, to control, I'm not even saying to eliminate a disease, an epidemic, and even a pandemic, you need to be able to diagnose it, to treat it, to prevent it. So yet here we are speaking about a pandemic with a virus that is extremely transmissible and that until now has affected millions of people and caused millions of deaths, and it's not over. So as you reminded us, I think let's not forget that this discussion is not that we love vaccines and we would like people to be vaccinated. This discussion started because there was a need to address inequalities of access between rich nations and developing countries, where because of the monopoly of production and supply by few manufacturers who are protected by IP rights, operated a real heist. The rich countries operated a real heist on all production, leaving millions of people without access. And rich nations even bought up many more vaccines doses than they could use. So limiting the waiver to vaccines only and not including diagnostics or therapeutics, for me, doesn't aim to solve the problem. And it has only one objective, which is to limit to the maximum the impact on profits of pharmaceutical companies. A kind of, okay, they may lose some on vaccines, but they will still make business of diagnostics. So it's not for the people. It's really a discussion that is intended to minimize this impact, although I'm not sure there will be an impact, because we have seen that pharmaceutical companies made huge profits on the vaccines, etc., even if these vaccines have not been supplied everywhere in the world. So Pfizer alone freshly cemented that they expect as much as $22 billion from their new pill this year, on top of the 37 billions that they made in 2021 from the vaccines. I think the Omicron discussion is maybe some people saying now, okay, COVID is a mild disease, etc. So we need to be careful about that. In the near future, we have no clue what variants will emerge. We don't know how severe these will be. We don't know how treatment and even vaccination protocols will look like. And depriving developing countries, people from essential tools of diagnostics that could guide prevention and even vaccination and treatment protocols in the future, and enabling them to have drugs. And as you said, Sangeeta, these exist today to treat severe cases is just irresponsible. So I think it's not new, but we're doubling down on a two-tier world. Rich, highly vaccinated nations with easy access to both prevention, diagnostic, and treatments, and the poorest nations trying to get by without anything or with one and not all the tools that are needed to address this pandemic. So I think it is vital that we don't sleepwalk into giving corporations so much control over those who get life and those who get to die, all balanced with what they deem an acceptable bottom line. But just to end, this is not new. It reminds me of the early years of the HIV epidemic, where some countries, some rich countries, including those represented at WTO now, and some big foundations working on public health, they just said, Africa, treatment is not going to work for Africa. People who have HIV are going to die. Let's focus everything on prevention and work for a new generation of people who have HIV, who are HIV negative. And with our efforts in prevention, they will stay HIV negative. I think the history showed that they were wrong. And if we made the progress today to control the epidemic of HIV in sub-Saharan Africa, it is because of a combination, or thanks to a combination of testing, diagnostic, prevention, although there is no vaccine for HIV, but there are prevention tools, and treatment. And I think it worked because we had a combination of these three. So today, preventing with vaccines without diagnostics and without treatment is not going to help us. So I think the companies have made enough money until now, and I don't think that this will change to them. And I don't think the role of WTO today is to defend the interests of few companies. The role of WTO countries and member states is to defend their countries. And I think WHO director said it, and everybody said it since this pandemic, nobody is safe until everybody is safe. So WTO should make decisions to protect country member states, to protect communities, and not to protect or to enrich few corporations who are already rich, who became much richer with this pandemic at the same moment where the countries and the communities have suffered a lot from the economic impact, without speaking about the public health impact on the economic impact, and became poorer countries and poorer communities. So for me and for other communities we work with and the people we are working every day on a country level, prevention, diagnostic, and treatments work together, and we cannot separate them if we want really to address this pandemic.
No, thank you very much. And I think interesting thing is, if you look at what WHO is saying, what the US, the scientists are saying, the most senior officials, what the European therapeutic strategy is saying, they all recognize that testing and treatment are complementary tools to vaccination. And they are totally crucial, to address COVID-19. But often I've heard access to vaccine, okay, they realize it's a problem. They do not recognize access to therapeutics is a problem, for instance. I think many of these, countries that are opposing would point, apart from the fact that they want to protect the profits of big pharma, they kind of point to, all these voluntary licenses that are signed, right? So, and they do not see access to be an issue, pointing to the voluntary licenses. So I wonder, Lina, if you can speak a bit, how important it is, because you're part of the MSF Access campaign, how important is testing and treatment? And, what about these arguments that they are making that, this is somehow there's no access issue, maybe that's the narrative, or, that has already been resolved through all these VLs.
Yeah, so it's particularly challenging when it comes to therapeutics, because therapeutics have received much less political attention. And what has happened in many countries is that the therapeutics have not matched the waves. I mean, that's been our experience in India as MSF as well. We were trying to buy tocilizumab. By the time we got our hands on it, it was 6 months down after the Delta wave. So therapeutics haven't really matched countries' needs when they've really needed them. And despite that, you hear this argument that, for the time being, let's have the waiver for vaccines. Now, that's a very dangerous argument to sort of make, because you've got the WHO guidelines, living guidance being updated in the last 2 or 3 months, and slowly a significant number of drugs are coming through the pipeline. And we've seen drugs for severe disease, which is really very critical to prevent people from going on the ventilator or getting very sick. And you've got drugs like antivirals that prevent people who have mild or moderate disease from getting very sick. So you've got these updates, living guidance coming out from the WHO, countries perhaps going through a process. I've seen South Africa, repeatedly update their guidance as well. Now, if you ask me what I spend the day looking at, I spend the day looking at baricitinib and how would it be exported out of India? It's a drug that's patented in India. What steps would the government of India have to take to facilitate the export? What steps the importing countries would have to take? Can ACTE, which is a facilitative body of agencies who have been helping countries procure drugs, do this job? It can't, because it's not a registered entity. It is not a member state. So if you look at these issues and you look at 31 bis, you know that it is not fit for action in a pandemic. Despite that, if you were to try and get baricitinib out of India, the kind of complexities of the processes itself would defeat the whole purpose. So I have to say that I have to highlight that it's an extremely challenging aspect of working on therapeutics. Now, if you look at voluntary licenses itself, baricitinib went under a voluntary license to a number of generic companies who are quite competent to make quality generics and are now offering baricitinib at less than $14. The challenge is that the voluntary license in India covers only India. It can't go beyond India. So Lilly has just restricted a very affordable drug for severe disease to be available only to Indians. My colleague from ABIA in Brazil is going to be talking about the situation in Latin America and what's been happening despite some progress on voluntary licenses. Latin America has been hit hard by exclusions, both in voluntary licenses, but also by the fact that these drugs are systematically getting patented. So my key messages actually, on this issue is, firstly, to the US government, you've done a phenomenal job of coming out and supporting the TRIPS waiver. Take it to its, meaningful end, because you are working to say that, the waiver should cover vaccines. But as the treatment provider, as MSF, we would request the US government to, finish the job and make sure that it covers therapeutics and, other areas as well. Now, if you look at the European Commission's position, if they spent just a single day trying to figure out how baricitinib were to go out of India, they would know that the proposal is not fit for purpose. You just have to spend a few days trying to figure out how a patented drug in a key manufacturing country would reach other countries who themselves have a patent barrier or have to notify the WTO. And then if you look at ACTE, the agency that's been set up, would they be able to do the job? No, they can't do the job for member countries. They're there to facilitate access. They're there to facilitate procurement. But all the steps described in the TRIPS agreement, they can't take. So the EU position also is not fit for purpose. It just doesn't work. So I would just simply say we need a meaningful solution for the therapeutics issue. And, the TRIPS waiver, if it's restricted to vaccine, that is not a meaningful solution, especially as we are treatment providers. The other issue that before I end, I wanted to say is that people talk a lot about pandemic preparedness. A part of pandemic preparedness is knowing how you can, trade in legitimate generics, how you can supply legitimate generics to countries who need them. Well, in that case, neither do we have pandemic preparedness, neither is the situation on therapeutics and the IP situation a solution that, the EU, the solution offered by the EU is meaningful. So I would just like to simply say that we clearly have to move beyond the EC's proposal. We have to clearly move beyond the US proposal. And I would appeal to all countries to look at the therapeutics issue before making up their mind and accepting the US position on the EC position. And I think this is perhaps our message as MSF, and I'm going to stop here.
Thank you very much. Baricitinib is a therapeutic recommended by WHO, just to mention that. And it's, as you mentioned, it's widely patented. So for me, when we look at, and sometimes we get this question, if you have flexibilities, why do we need a waiver? Now, if you have a flexibility and you can do a compulsory license, you would have to do product by product, and typically that's what is done under Article 31 of TRIPS. So say we get a product today, we know it works. Either you use the CL or we wait to see whether the company wants to enter into a VL, and then this voluntary license will come with various terms and conditions. It will exclude countries, it will have other terms and conditions. But if we have a waiver, a full freedom to operate, follow-on manufacturers can enter the market. Would you agree with this statement that I've just made? This is why the freedom to operate is very important, because we have seen, and we see this in real time for several of the therapeutics, where patent is not a barrier. Manufacturers are able to enter the market, but we don't see that for baricitinib because, as you mentioned, it's widely patented, and then country has to take action. So I mean, and this would have to be done country by country, depending on your law, what your law says, and it's not an easy process, as you mentioned. It's not an easy process. It involves various ministries, normally at the national level, Ministry of Health, Ministry of Trade, Ministry of Justice. There are many issues and different procedures as required by the TRIPS agreement. I wonder if you want to speak a bit on what are some of the terms and conditions we often see in the voluntary license?
Lina? I want to highlight a particular a condition in the voluntary license that I think particularly is very problematic for a number of countries outside the license who have manufacturing capacity, which is the one that, the API will only be supplied to sub-licensees, So
the active pharmaceutical ingredient, yeah.
The raw material that goes into actually manufacturing a drug. And, as you know that, there's a huge amount of capacity to reduce prices by improving the API process, the raw material process. But many countries across the world which have manufacturing capacity to make finished formulations can't buy the raw material from places where they are available affordably because, for example, the Indian generic manufacturers who have been playing a very big role in API manufacture can't supply outside the territories. And I think this is where, when people talk about scale up of manufacturer, where people talk about regional manufacturer and people talk about self-reliance, I think the voluntary licenses are really painful. And I think in the past, Felipe from ABIA and, MSF have worked to challenge the tenofovir voluntary license and patents for this precise reason. And, we were extremely lucky that both the Indian Patent Office and the Brazilian Patent Office rejected those patents. But unfortunately for COVID drugs, we don't have a system in place to reject those patents. And that's why we are back to the question of the waiver. Yeah.
Okay, thanks a lot. Felipe, so it was mentioned about the challenge of access in Latin America. Maybe you could give us a bit of an insight on intellectual property, COVID therapeutics, and what is the challenge there?
Yeah, thank you, Sangeeta. Thank you, everybody who joined us today. So I would like to start by saying that the need for drugs in Latin America is really huge. And the reasons for that are basically the burden. It's important to put in context that Latin America, the countries here have been facing devastating consequences of this pandemic. And around 1/3 of all COVID-19 related deaths are from Latin America. And in South America alone, we had more than 1 million deaths, despite the fact that this part of the region concentrates only 5% of the world population. So there is a huge burden, there is a huge impact. And until now, the drugs are not available. I am from Brazil, one of the countries that was the hardest hit by the pandemic. And until now, we have none of the drugs in the public health system. Either the drugs recommended by WHO or the drugs approved in developed countries. None of them are available for people that needs to use the public health system. So we have been through this situation of total collapse in different waves. And we had to deal with that without any access to drugs that were, increasingly being recommended and approved and proven as effective. So this means that people who are with severe forms of the disease or at high risk are totally excluded from the drugs they need, and that's totally unacceptable. Another reason is that although we had made progress on vaccine coverage, it's important to remember that 13 out of the 35 countries in the region are until the end of February were still below the 40% target set by WHO. So there are a lot of people still unprotected, and access to recommended, easy to use drugs is essential to cover and to address the needs of this population. And finally, countries are trying to move for a new stage of disease control, trying to alleviate social distancing measures, but that will not be effective if we don't have proper testing and treatment approaches in each country. And the reality is that people are still struggling to have regular testing. The prices are very expensive, people are not able to afford, and treatments are out of reach in most of the countries. So that's basically the context in which we are dealing with drugs. And as Lina said, like the need for drugs, it's there, but the responses and the solutions that are being proposed by the global stakeholders, the pharmaceutical companies, are not sufficient, are not addressing this need, because now the health systems here are very fragile. The budgets are limited. Some countries are in debt because the purchases of vaccines, they had to borrow money. People are at risk, and the affordable drugs are not here. So the waiver is actually the best option for us to overcome this whole situation. And to be honest, many lives could have been saved already during the Omicron wave if we had adopted the waiver some months back. That's an important remark to be made. And if we look to particular drugs, as Lina said, Latin America is normally actually always left behind when it comes to access arrangements. So that's why countries from Latin America should be even more vocal in supporting the waiver. So if we look to Paxlovid, the drug from Pfizer, there is not enough supply. This is widely known. And for countries in Latin America, this means not being able to even start negotiations. For the first semester of this year, there are no supply. There is no stocks available. Everything was sold already to rich countries. So the perspective of accessing generics is not there. There are only 8 countries in the region included in the scope of those that can buy the generics when they exist. In many of the countries, the patents are already being applied for, and some are already granted. So this puts the countries in a position of very hard negotiations in which they have to accept every conditions imposed by pharmaceutical companies. So the voluntary license, in the end of the day, for countries in Latin America, what they do is to increase even more the negotiation power of companies and reduce even more the negotiation power of countries. And this is terrible for the populations, because their health systems are already close to bankruptcy. There is no money, and governments need to accept high prices, delays in the delivery of the drugs, conditions that are very abusive, secretive deals that cannot be publicly disclosed. So everything comes together in this context. And the other drug that would be really important at this stage is baricitinib, also for severe cases, but it's already patented in most of the Latin American countries. The prices are very unaffordable for governments. So people are basically not having any chance of being treated with this drug that can bring people out of, hospitalization and save a lot of lives. So people are simply, maybe in the private market, maybe people who have a lot of money can find a way to buy those drugs, but for the general population, this is not happening. And the stark reality is that in Latin America, we also have a lot of willingness and capacity for local production. We have seen over the past years a lot of political declarations around the importance of self-sufficiency, local production, And indeed, for these drugs, there would be a capacity if there were freedom to operate, if there were, a policy space for new producers, we could have local production of these important drugs in the region. But this is not happening, and governments are speaking about those plans, but the reality is that they need the waiver to implement, some of those strategies and to change the situation that is being, that is resulting in the end of the day in a violation of the right to health of the populations of Latin America. So yeah, we urge countries from Latin America to be more vocal on the waiver and fight for a meaningful result, not a reduced result of this negotiation that brings out, that takes out drugs that reduce the scope of the original proposal. That's not acceptable. That will not address the needs of the populations. So we need to stay very clear in what needs to be achieved. The world needs a strong response, a strong solution, and countries need to be unified around this solution. And we do believe that the waiver can contribute a lot. And for drugs, this is very, very clear. A lot of things will change with the waiver in regards to access to drugs in Latin America. Thank you.
Thank you very much, Felipe. And I think we have to mention that what you have described, very eloquently, as to the situation in Latin America, we see this similar situation in many developing countries. Limited health budgets, looming debt crisis because of what they've spent on vaccines, and we will have to spend more for vaccines, because we know that there could be new mutations, we will need new vaccines. So these are all challenges many developing countries face. So thank you very much for highlighting this. I wanted to move on to the second part, which is on the scope of intellectual property. As we know, if you look at the proposed waiver of the co-sponsors, they propose that the outcome should waive specific TRIPS obligations with respect to patents, trade secrets, copyright, and industrial designs. And we know these are all aspects that can actually erect barriers for follow-on manufacturers. But the EU has been opposed, and instead it seems to be looking for an outcome in the context of Article 31 of TRIPS. This is often known as compulsory licensing of patents. We know based on various news reports, this is where their interest lies. They do not want to discuss anything beyond that. News reports also suggest that there is also a push to add conditions, maybe criteria that limits the use of the outcome. And we have seen this before in the WTO negotiations in 2003 when they were developing a mechanism for supply to to countries with insufficient manufacturing capacity, a CL mechanism for export. It was subject to many conditions, detailed notification requirements, anti-diversion measures, many other notification requirements as well, and largely due to the demand of developed countries, in particular the EU and the US. And the result has been, it's ineffective. And we have been arguing, and it's just not worked, this mechanism, right? So I wanted to pose a question to Brooke. Can you explain if EU's approach is sufficient for a meaningful outcome? And what is the impact of attaching conditions, criteria, anything that limits the use of the outcome?
Okay, thanks so much, Sangeeta, and to everyone who's attending this important webinar. So just as a little bit of additional framing, I think a lot of the initial discussion focused on the need to expand supply of all the therapies. But we should also realize that expanded supply is critically important, just to have enough of vaccines, enough of medicines, enough tests to actually reach global need. But expanding supply, particularly by generic producers who don't have monopoly rights, will also increase affordability. And for countries that are strapped with the impact of the pandemic on resources, the demand for resources to respond to the pandemic, price is critically important. And then finally, we have a system where the decision of who gets the medicines or who gets the vaccines is totally left to commercial interest. the monopolists get to decide not only the amount being made and they artificially restrict it, not only do they artificially raise prices to maximize profits, but they also decide who gets first in line. And the decision in every instance is rich countries get in line first, right? So it's within this context that we're assessing the voluntary measures. It is in this context that we also should evaluate the European Union proposal about compulsory licenses. So we don't want to present a picture to say countries should never resort to compulsory licenses. It's a measure that it has practicality problems. There are many complexities in its use, but we would still urge in many instances that countries can and should use them, particularly with respect to access to therapeutics. But I also want to emphasize that the proposal by the European Union is impracticable and insufficient to meet the emergency needs of this pandemic. So first of all, as Sangeeta previously suggested, the Article 31 and 31 bis of the TRIPS agreement provide for involuntary access to patent rights only, only to the basic knowledge about the invention. But there's so much more that goes into medical products, particularly vaccines. So we know, for example, that regulatory data, trade secrets, confidential information, complex manufacturing know-how, and biological materials are all now trapped within a safe kept at the by the monopolists as secret and unavailable to other producers, in some instances even to the government. And that's simply unacceptable, because an alternative producer cannot now make a vaccine without that underlying know-how, or it has to go through the arduous process of recreating that know-how itself, which is, for example, currently being done by the Technology Transfer Hub in South Africa. And they have estimated this will add years to the development of a copycat vaccine in South Africa. But there's also copyrights, there's software, there's manuals, there's protocols, there's a need to mine data. All of these are rights protected by copyright. And then finally, industrial design. All of these additional rights are critically important. So the European Union has pretended that these other rights aren't important, whereas in fact they are critically important, particularly for access to vaccines and biologic medicines. So we need the whole technology package. We need everything that would allow a new producer to come on and make the new product quickly and efficiently. We need the secret recipe and the kitchen in order to speed up the delivery of these new products. A related problem is that the patent landscape for many of the new COVID technologies is not known at this point in time. The right holders can wait a year before they file a patent on a new invention. It's secret when it's first filed. It's filed, but it's not disclosed in any way. It's not published. So in many instances, we don't even know what patents are in the pipeline. And so we still have many patents which are undisclosed on COVID technologies, and we have new patents being filed every day. And the due diligence that entities would have to undergo to try to discover the patent pipeline could be very time consuming and expensive. And to some extent, you need to have identification of that patent pipeline and patent landscape in order to effectuate a compulsory licenses. So Sangeeta has already mentioned that compulsory licenses are product by product. Actually, they're patent by patent. But on a particular product, and country by country. Now, let me just put some concrete numbers to the problem that Sangeeta has described. For messenger RNA vaccines, industry says there are 280 plus components that are sourced from 19 different countries. If any of these components, let alone the final biological vaccine, are patented, or patent holders won't or can't supply or won't include you in a voluntary license, you will have to get a compulsory license on potentially all of those components in different countries. You will also have to have compulsory licenses to get them to the place of manufacture if it's another country. And you also need another set of compulsory licenses from that intermediary place of manufacture to the place of final formulation. And then you'll need additional compulsory licenses for importation into countries that actually buy and use the product. As you can see, this is a blizzard of compulsory licenses on complex products. And just to navigate that according to each country's individual rules, some countries don't even have good mechanisms for this. A vast majority of countries have not adopted the procedure set forth in Article 31 bis for production for export. It's simply a huge problem of coordination and cooperation under the best of conditions, but it's impracticable for an emergency like this pandemic. Compulsory licenses in some countries may not be available on pending patents. And for most countries right now, COVID patents are just pending. They're not finalized. The patent offices have not granted them. A few countries have. South Africa regrettably has. But that, I think there are interpretations that countries should be able to issue compulsory licenses on pending patents, but some countries might be hesitant to do so. In some, the waiver proposal eliminates all of these complexities and uncertainty. It basically gives the freedom to operate that Sangeeta described, where an alternative producer and a country that needs to try to get supply for its own population can immediately take steps to authorize for another producer to come on board, and not only to make for a domestic market, but to make for export to other countries that have similar need. And of course, we need regional cooperation in many circumstances. The same problems that arise with respect to compulsory licenses also apply with respect to opposition, the procedure by which civil society and sometimes generic companies can oppose the grant of a patent. But again, that's patent by patent, it's country by country. You have the problem of unpublished patents still, and the delay and uncertainty that goes with prosecuting patent oppositions. Again, oppositions can be used and they are being used, but it's still not an adequate solution to this pandemic. So I want to turn to the second thing that Sangeeta asked me to address, which is the idea of country eligibility criteria or other conditions on use of the waiver. Who could imagine a worse idea than in having some country have the hands tied behind their back to both use the waiver for the benefit of their own population, but in the countries that are being targeted may in some instances be the source of needed products for other countries, particularly this push that the US members of Congress and others have been pushing. Oh, we can't let China get this technology. Some people say we can't let India get this technology. Now people are saying, well, we can't let Russia get this technology. And this just ties the hand of the international order and international flow of goods that's needed to address this very complicated supply chains that supply components and final diagnostics, therapeutics, and vaccines. So all these proposals that we hear leaks in the press that there's some effort to restrict the countries that are eligible or put conditions on what countries can do is just a terrible idea. So I'd like to end by making the point that we've heard about the problem of excluding important technologies, vaccines and therapeutics. We've heard about proposals to limit our solution to patents only. And just to say, this would be a very bad outcome. This would be the lowest common denominator of two bad proposals, one from the US focusing on vaccines only, and one from the EU focusing on patents only. An outcome with these terms would be worse than no outcome. And I think other participants may want to state whether they agree with that analysis. We cannot have limitations on product. We cannot have limitations on the intellectual property issues that need to be addressed. We cannot have countries that are carved out of participation. A bad agreement is worse than no agreement. Thank you again, Sangeeta.
Thank you very much, Brooke, for addressing all of that in much detail. I think we want additional tools. We want greater flexibility. We need greater freedom to operate than what is there. And we need to remove, if there are existing barriers in the flexibilities, we need to remove them. And I think all of this has to, as you mentioned, should not be subject to further conditions. We have seen that, as I mentioned before. And at the end, it's in everybody's interest to have a workable outcome that actually promotes access. So can I turn to Laurie? So the Biden administration supports an IP waiver although it's for vaccines, and we have addressed the scope of products, but they support an IP waiver, which would mean a waiver across the TRIPS agreement, and not just one that is very narrow or limited like the EU. Now, the EU, as we have heard, is not agreeable to that. What should be the role that the US should be playing in these discussions at the WTO?
Well, first, I want to thank you for including me and thank our audience for joining us. And I feel really honored to be in this panel of amazing fighters and leaders for public health from whom I have learned an enormous amount. As far as what the US needs to do is to follow through on its stated support and help enact a waiver, and a meaningful waiver. An actual waiver of IP, which is the stated US position. The position of the US is not a patent waiver, despite it being written about that way. And what is the stated position of the US just for vaccines needs to be expanded at this juncture, now that we have treatments available a year almost after the US support initially of a waiver, to also include treatments, tests, and the other technologies that we need to actually address the public health crisis. I think it's worth thinking about how we got here, because the world celebrated the Biden administration in May 2021 for supporting an emergency COVID waiver of intellectual property monopolies. It was very noteworthy because usually the United States and the European Union were united in blocking access. And indeed, the Trump administration had provided cover for many other countries in the world to be against. The US, the new administration, the Biden administration, President Biden announced he recognized the extraordinary circumstances that required extraordinary action. And that hasn't changed. Almost 6 million people have died and millions more will. The economic devastation is obvious. The things that we thought could happen have happened. Yet now, almost a year later, and on the anniversary of the World Health Organization declaring a pandemic, there still is no waiver enacted. A lot of the countries that had hidden behind Trump joined the US right up front, and some others did after amazing campaigning, like in Australia. So that today we're in a circumstance which I think the press coverage does not sufficiently highlight. The whole world at the WTO is for a waiver. The details of how meaningful, what it covers, that's where the fight should be. But just the European Union, Switzerland, and the UK are exploiting the consensus decision-making process at the WTO to shamefully block the waiver supported by the rest of the world that's direly needed. And that marginalized bloc is not subtle in endlessly repeating the pharmaceutical corporations' arguments in favor of lengthy intellectual property monopolies. Even 2 years into the pandemic, the companies have proven they will do nothing voluntarily to help. As the exclusions that Lina and Felipe have described demonstrate. And Moderna is now saying it will enforce its vaccine patents. The treatment licensing arrangements that we've heard from my colleagues that exclude countries like South Africa, Brazil. Yesterday, the World Health Organization's Martin Friede even finally noted that the freedom to operate, i.e. to make and distribute medicines, is undermined by this wave of patent filings. And consider what this could mean for the amazing initiatives like the mRNA hub in South Africa. So even with this body of evidence of pharma's unrelenting, deadly greed, I worry in part that the few countries blocking at the WTO are doing so in part because the US is not doing anything as fulsome as it could to counter the EU's shameful strategy of endless delay and obstruction. I've watched the US government over 30 years operating at the WTO, and I can say that I have not seen the all administration effort mustered that has been brought to bear in favor of corporate initiatives of bad things at the WTO, or the relentless diplomatic pressure on countries that are blocking the US position. I understand the complications of that. But at this point, I think that something has to shift because the current strategy has not delivered a waiver. The trade representative, USTR Catherine Tai, I believe is entirely committed and sincere in wanting to obtain a meaningful waiver. And the United States president is a man of compassion, rooted in his deep Catholic social justice faith. And also, the US strategy to date has not delivered a waiver. So, more direct engagement, Sangeeta, with the EU to stop the blocking seems to be a strategy well worth pursuing. Because as my colleagues have explained, the EU objects to an actual waiver of the intellectual property monopolies and wants to basically pretend that talking about something that already exists, which is flexibilities around compulsory licensing, will somehow achieve the goal. When, as my colleagues have made clear in this webinar, that approach is deeply, deeply unsuited to purpose, will not deliver the greater production, will not deliver the access, will not deliver the ability for countries to not have to wait in the back of the line, even if the production were available. It's very worrying that the lowest common denominator outcome of the US demand for vaccines only and the European demand for no real waiver could end up in a position that is worse than the status quo. And that is why I want to reiterate what Brooke just said, which that kind of a deal is worse than no deal at all. That's why it's not surprising that as we are 3 months out from the rescheduled WTO ministerial, the absence of a meaningful waiver deal could block the entire ministerial outcome. That's appropriate. The very first thing the WTO has to do at this juncture in world history is to get out of the way of a huge, worst in a generation public health crisis and have a waiver that is meaningful, that delivers access actually enacted. Nothing else should happen at the WTO unless and until that is achieved. So the WTO can set internal deadlines, but civil society supports the WTO member countries that have made clear that unless and until there's a meaningful waiver enacted, there's no legitimate basis for other business at the WTO. Because already the delay caused by the WTO, already the outbreaks that have ravaged the world mean 6 million dead and mean we have lost the race between vaccines and variants. The breakthrough variants caused by mass outbreaks, creating mutations, creating variants, mean that now it is critical that the world have access to treatments. The best mRNA, most effective vaccines are effectively treatments in their own right. They reduce death, they reduce suffering, and such all as well must be accessed for the actual treatments that have been developed. So the United States president, at the State of the Union address on March 1st, announced the only way forward for the US now, given the epidemiology, is treat and test, test and treat. Certainly, what is right for the US is something that the US president must help ensure the rest of the world can have access to. And that requires a meaningful waiver of not just patents, but all IP with respect to vaccines and also treatments and also tests. That is the only way forward for the rest of the world as a moral matter, but also for the United States. It's in the national self-interest for the sake of trying to avoid future variants, of avoiding more social and economic disruption. And that's what activists in the United States and many in the United States Congress are seeking as we have 3 months before the WTO's rescheduled ministerial. Thank you.
Thank you very much, Laurie. I think, promise of IP waiver, will the US deliver that? And you have very well pointed what it means for the WTO. At the end of the day, Professor Stiglitz has said, unless we do everything, we'll be entrenching unconscionable inequality. And we have already seen this, right? We have seen this in 2 years. And, heading June, middle of June, the ministerial, I think we need to see something concrete in terms of what can be delivered for access. So now just coming, I don't see many questions. If anybody has questions, this is the time to put it in the Q&A box. But let me just begin with one, and I've heard this argument made several times. The waiver will affect the incentives of innovation. As we know, public funding has played a big role, but those who make these arguments don't recognize that aspect. I wonder if any of the panelists want to address this incentives for innovation. I know Othman did mention about the profits that Big Pharma has already made. Would any panelists would like to, take this question? Then there are some questions in the Q&A. Just raise your hand if you'd like to respond. One is on BRICS countries. BRICS countries. On this BRICS platform as a parallel track to continuing efforts to obtain patent waivers at WTO and other multilateral organizations. There's another question about waiver promoting tech transfer and know-how, and how do we address the lack of investments to develop know-how and facilities. And I think this is again linked, that waiver would affect the incentives. There is a few comments by George Carter. I think it's more of a comment, but also there have been an announcement about public vaccines and therapeutics, right? And of course, this can play a role with respect to contributing to access. So these are some of the points. Othman.
Yes, maybe speaking about the incentives. Well, if we are speaking from access to medicines in general, without looking at the pandemic, etc., it's a big discussion. But maybe let's go back to the waiver and to the situation of this current pandemic. First, we should know that most of the research has been done by public funding. Second, pharmaceutical companies, the fact that they didn't supply many parts of the world didn't have any impact on their profits. Companies made huge product, whether they sent vaccines to Morocco or they didn't. Actually, we received the rest of Europe and the US. When the US didn't want to use the J&J, they gave a donation to Morocco. And when Europe didn't want to use AstraZeneca anymore, they gave it for free to Morocco. So there is no loss actually, because the need is so huge. And the few suppliers who are in the markets, whether they have willingness or not to produce, they are not able to produce. So I think the question of incentives in this specific case or discussion is really not an issue. It can be an issue if we are discussing about access to medicines, a new model for developing drugs, etc. And definitely it's a big discussion. But frankly, in the current situation, they will still make money. They won't have the capacity to supply the entire world. And we need a lot of suppliers if we want to respond in the same way and collectively, and as we have been doing for other diseases. And as Laurie reminded us, if the strategy in the US is really to prevent and test and treat, it should be the same for Morocco, for Mauritania, India, and it should not be only prevent with vaccines in Morocco and then no diagnostics, etc. The question of having platforms for production or to select few countries who are going to produce for the rest of the world. First of all, there is capacity of production beyond the BRICS countries, even for mRNA vaccines. When it comes to the therapeutic, it's much more easier in terms of regulation and marketing authorization, etc. And the capacity is huge. Let's not forget what happened before. When we had voluntary licenses on remdesivir, India was supposed to produce for the rest of the world. Then we had the outbreak in India. And then India was not even able to supply to remdesivir for India. So if we select few countries, we have no clue what's going to happen in this future. Vaccines. India was supposed to supply vaccines to my country, Morocco. We got the second shipment from India, then India stopped exports. So I think it is dangerous to select few countries and to say, okay, the problem is going to be solved. We are going to transfer technology. We give voluntary licenses. We need production, especially in a context of a pandemic, to happen everywhere where this is possible. And I think, as Brooke explained, the only way is to have this freedom of operate, is to have not to ask questions, how many patents are there, how many patents are still being examined, how to issue a compulsory license on a patent that is not even granted and still under examination. So this production can happen everywhere. I think there is an important report by Human Rights Watch who was looking at the capacity of production, and we see a lot of countries in my continent, Kenya, Morocco, Tunisia, Egypt, all of them have the capacity to produce even mRNA vaccines today. So let's not forget what happened when China alone was supplying masks to the entire planet, when India was supposed to supply vaccines to developing countries or remdesivir to developing countries. The situation may change and these countries may take decision. And I think it is legitimate. Sometimes it's difficult for politicians that they take this decision to keep the supply for their own population also. And this is something, it's sad, but at the same time, this is something that politically can be understood from decision makers.
Thank you very much, Othman. Felipe, there is also a question for you about Latin American countries and the role of in the TRIPS waiver discussion. If you want to address that as well.
Yeah, sure. I'll just drop a quick comment around BRICS, and then I will jump into the other question. So just a second. Maybe
we can go to Lina first then.
Sorry. I'm back. Just had an issue. Yeah, so on BRICS, for sure, there is a lot of potential on BRICS, and we have been from ABIA following a lot of the declarations that BRICS have done over the past years, some of the initiatives which are quite interesting. Not only on COVID, there was a joint funding, for example, for research on COVID that the BRICS have put forward. But previously on tuberculosis, there were research networks established by BRICS and some initiatives. But we do believe that more can be done, because in some moments there were some tensions between countries, lack of funding for important initiatives, lack of coordination to supply products. But for sure, the platform is evolving and has a lot of potential. But for the discussion that we are having today, I think the crucial points that we want to highlight for BRICS is that they need to be coordinated in negotiations. So, for example, the waiver negotiation, it's important to have a very strong unified position by BRICS, for sure, and in many other multilateral health-related negotiations, the same. And in terms of principles, BRICS can also have more leadership, because most of the declarations from BRICS health ministers over the past decades highlight the need for more transparent, more sustainable, new models of research and development, the principle of the linkage, which is exactly decoupling the price from the price as the mechanism to recoup the investment on R&D So there are very important principles that the BRICS are already mentioning in their declarations that need to be applied in real world, in concrete cases of drug development, of how know-how is shared, how prices and conditions are established over products resulting from public funding, especially. So yeah, for sure, BRICS could do more and show more leadership on that front. So on Latin America, to finish, there was a question about how to energize countries. I think there has been some recent progress with Argentina also joining as a sponsor, apart from Bolivia and Venezuela that were already sponsors to the waiver proposal before. The concern is that many countries in Latin America are still silent. So I think the important next step is a coordinated position. It's a unified position from the region. And there are some efforts around that. There are some proposals of joint meetings and things like that to try to find a unified position. And I think as civil society, we need to push for that. We are pushing governments already to use at national level all the measures they can to improve access to drugs. But in terms of the waiver, we also need to push these governments to have a unified, coordinated position, because there is a strong need in Latin America for that measure. And this needs to be clear to governments. And that's our role, our contribution as civil society.
Thank you very much, Felipe. Lina, did you want to take the floor?
Yeah, so I just wanted to quickly point out an important element of the debate and the discussion that we should be having as people from the South. And one of that is that at the time when the TRIPS agreement was being negotiated, a part of the very strong narrative in its favor built by, developed countries or high-income countries, particularly those that house the big pharmaceutical corporations and continue to do so, argued that, intellectual property protection would make technology transfer much easier, it would flow much faster. And actually, it's just the opposite in a way that's happened. And we need to relook at the patent system very, very closely. Now, if you look at South Africa, South Africa has been very generous with patents and just granted a number of patents to Moderna over mRNA technology platform. Has it seen the technology itself in its own home country? Not at all. So I think we really need to be careful about the technology transfer issue, because the conditions for creating technology transfer are other than intellectual properties, the kind of investments governments make, the investments they make in science and technology, in organic chemistry and other areas of science, and of course, most importantly, looking at how they can create a regional or domestic market for local production. So I think we really need to relook the whole issue of technology transfer, because it's a failed promise that's left over from TRIPS and absolutely failed during the pandemic.
Thank you very much. Laurie, would you? And I'll come to Brooke. There are a few questions on copyright and mRNA Hub. And as you know, Moderna, has recently made some announcement. Maybe you would like to also address that. But Laurie.
Very quickly, I just wanted to address the question. No, a ministerial is not necessary. A WTO ministerial is not necessary for a waiver. A meaningful waiver is necessary for a successful WTO ministerial, however, which is to say that at any general council under the actual rules of waivers, which is Roman Article 9, so 1X or IX of the agreement establishing the WTO, a waiver can happen at any general council. And if you think I'm exaggerating, you can Google and get the list of waivers by year that happen at general council meetings. So that can definitely happen. It should happen. My point of mentioning the ministerial deadline is, though, that absent a meaningful waiver, a waiver that actually can deliver on access so that the countries that support a waiver will support it, absent that, the WTO ministerial is likely to be deadlocked, and so it should be. And given the United States and Europe are keen for the WTO to be functional again, they want to get it out of the ditch where it's been moldering, then it's in their institutional interests, separate from the moral, ethical, public health, and economic interests, to actually get a meaningful waiver done before the ministerial, so as not to have yet another ministerial that does not actually happen. And I don't mean is unscheduled. I mean is just angry people staring at each other, waiting for the WTO to stop killing people from COVID. And I want to just flag that with respect to a question that was posed also, how could more Latin American countries support? It is possible to vote. I mentioned the EU exploiting the consensus, but that is a practice. A waiver by the rules of the WTO can be put into effect by a vote. It has not happened. The WTO has not used its voting rules. But at a certain point, more countries sponsoring the waiver makes it much more valid that a vote could be forced. And if that ultimately is the way down the road, I am sure that would not make the US and the EU happy, but that will be the problem that they cause if there isn't a way by consensus to get a meaningful outcome.
No, thank you. Thank you. And I just want to mention, actually, I think more than 90%, maybe even more, 95%. I don't know the exact number, but it's most waivers are taken by General Counsel, more than 90% for sure. So General Counsel can definitely take the decision. I think it's where the WTO is going to deliver really at the end of the day ahead of the ministerial. We move on to Brooke. Brooke, a few questions for you on Moderna, mRNA hub, copyright, industrial designs. I know you addressed that part already, but if you just want to flag it very quickly. Just to mention on copyright and industrial designs, actually, the co-sponsors have a very good document that explain why they have actually included copyright and industrial designs, but also every aspect of their revised proposal. We could happily share if you're interested and you would like to get in touch. They have made a submission to the WTO. And I think finally, Brooke, there is a question about the role of big pharma, although it's in the context of the EU. But I think that the issue is the role of big pharma, in countries that are opposing a good outcome on the waiver.
So I'll be very brief. I think you're right on the copyright. I mean, the examples that we are most familiar with are the software that runs a lot of the equipment that actually makes the products, right? And it's necessary to have that. So the waiver proposal actually, also addresses the means of production, right? And so all the software systems and of course some of the testing devices actually have software embedded as well. But then there's manuals and there's data mining, additional copyright issues. I won't go into industrial design. I'll leave people to look at that on their own. So on Moderna and its recent pledge, again, it's a patent-only pledge at this point in time. It doesn't address the underlying know-how. It still refuses to give the underlying technology package to the messenger RNA technology transfer hub that is now in South Africa. So they're having to go through this arduous process of developing commercial scale manufacturing capacity. They've already made microliters. They've reversed engineered the basic production, but it's a big issue to scale it up to commercial scale. And that's where the underlying know-how, all the quality control systems, access to the equipment, the protocols for working the equipment, all of that would be beneficial if transferred. But of course, that's the monopoly right that Moderna wants to keep, that basic technology package, because they say they want to investigate many other diseases and get their same kind of monopoly rights on those others. Now, specifically, there was one very broad Moderna patent in South Africa, which is not examined patents. It just grants them. You can get a patent on a peanut butter and jelly sandwich in South Africa. You file the right piece of paper and pay the fee. And so Moderna has a very, in fact, probably overbroad patent application there, but it would take litigation to undo it. And Martin Fried and others are now on record recognizing that their effort to transfer a technology package to other countries will be thwarted by Moderna's position. Also, just to say that Moderna's position is most of the places that are designated as hubs, or at least several of them, are actually blocked because of the patent waiver by Moderna is only for low and lower middle income countries. So the upper middle income countries that are now spokes to the South African hub will be thwarted from commercial production because of patents filed in those countries. So the EU, and this is really about the US as well. It is pretty rich that the rich countries in the world that ran to the front of the line, that had the money to enter into, the cash on the barrelhead to secure advanced purchase agreements, and who invested in the medicines and vaccines, have gotten everything that they've needed first, more than they've needed first. And now they want to stand in the way of people who've been left in line waiting to die. They want to tell them, no, you can't have a source of supply. We're still going to leave you to the control of monopolists. I mean, this is really just outrageous. How, I mean, it's hard to talk about. It's not hard to talk about the northern post-colonial psyche that thinks that people in the north or countries in the north have a right to preferential access, but that people in the global south get crumbs instead, and maybe not even crumbs. It's just really outrageous. And people really need to look at the moral compass of countries that are willing to say, we got yours, screw you. And that essentially is what the EU is doing. Now, why are they doing it? Well, Big Pharma threatens them to some extent. We've heard the research and development, excuse, but there's a veiled threat there. Companies have said, well, if you take away one iota of our intellectual property rights, our whole system is threatened. And why would we ever invest in product development for pandemics in the future? Of course, that's nonsense, because the rich countries will always buy preferentially from Big Pharma. But then there's also this subtle thing. They also say, and we will always supply you first. We may charge you more, but we'll always pay you first because you're our best customers. 70% of Big Pharma's global profits are from sales in the US. And so they always put the US first. And there's this, I think the countries are sad, to some extent satisfied with this deal because, I got vaccines early and often in the US. If I get sick now, I can get access to the therapeutics that are now available in the US, but people elsewhere cannot. And why should these rich countries, because they want to protect the profits, bloated profits of Big Pharma, why should they stand in the way for the countries of the global south? And that's the real fundamental issue. And I really, would insist that the negotiators from the US and Europe look in the mirror and say, if that's the world they want to see, that's the legacy they want to leave for their children, is that, rich white people in the North come first, everyone else comes last or never.
Thank you very much, Brooke. I just want to add one more point, because you mentioned South Africa and examination capacity. So yesterday there was an event, WIPO released a patent landscape report. I think what is very clear is that the patenting activity is going to increase. And we know it's not just an issue in South Africa. We know that across the developing countries, there is a lack of examination patents, and many of these just get granted. Sometimes they just follow the developed country patent offices. Sometimes they just grant it, because to do thorough patent examination, you need resources. So, and if you look at the, what we're going to see in terms of patenting activity, and we have not seen the full scale, right? Because we know it's all kept secret, the patent applications, until the future. We are going to have a huge challenge of access. Although a lot of the drugs are repurposed, we see a lot of new patent applications, and these are going to hinder access. So I just wanted to add to that point. And of course, it is definitely in everyone's interest that we address the access issue. So we are coming close to the end. I wanted to just give maybe everyone 1 minute. If you have one message, whether it's directed at the US, the EU, WTO members, WTO, what would your message be in moving forward? Maybe I could start with Othman. 1 minute, well, not very long, because
No, well, my message will be maybe to WTO. I think for those of us who have been working on HIV, hepatitis, TB for years, we knew the system was broken and something needed to be done. Now the entire world knows the system is broken and it doesn't deliver. So it has been 2 years of public debate. Everybody knows it now, and something needs to be done. And as Lina said, I think the system has been built on promises that have never been fulfilled. Developing countries should grant patents, and they did, in an exchange of a promise of technology transfer that didn't happen, in a promise of if there is a problem with public health, of course it will be systematic to waive IP protections to ensure access to public health, and it didn't happen. So the last thing that WTO should do now is a waiver, is a real waiver. But there is a lot of work that needs to be done after that. And I think the role of developing countries, and if there are some who are here, they should really resist and make sure that this does not happen again, because there isn't only COVID, there is a lot of other diseases, and what happened now should just not happen again in the future.
Thank you very much, Othman. Felipe?
Thank you, Sangeeta. Thank you, everybody who joined. So my message is that Latin American countries have numerous reasons to support the waiver. They were hit hard by the pandemic. At the same time, they are excluded from access to the drugs that people need. They also have untapped production capacity that can build more self-sufficiency. But as we have discussed, pharmaceutical companies are blocking knowledge sharing in every way they can. So it's time for countries in Latin American region to coordinate a strong position in support of a meaningful waiver. And the best way to do this, it's becoming sponsors of the proposal to show the highest level of support. So that's my call to Latin American countries. Thank you.
Thank you, Felipe. Lina?
Yeah. So quite simply put, I think the US needs to expand its positions to include other areas. And of course, the EU EC position is quite untenable in the sense that, you know, as a treatment provider, we are looking at constantly at the need for therapeutics, and this is going to be an ongoing need. And what the case study of various drugs now shows, which we've just published online in a sort of interactive map where people can actually see the patents and the licenses where they exist and where they don't. It's very clear that intellectual property is a barrier to therapeutics, and we need to fix that. So there's absolutely no reason to not include these key areas in the waiver. So, you know, appealing to the European Commission, a big champion of human rights, that you can't leave key areas of you know, treatment out, as well to the United States. Yeah.
Thank you very much, Lina. Brooke?
So the business as usual approach to intellectual property has been a horrible failure of this pandemic, and the reluctance and refusal of governments to immediately address monopoly rights, to expand supply, increase affordability, and ensure equitable distribution is perhaps the biggest moral political failure of our generation. And we actually have to look forward to the future. It's broken now, and it will be broken for future pandemics. You know, to some extent, we need to be talking about an overhaul of this inadequate system. Certainly for pandemics, certainly for this pandemic. But I would argue that at this point, the waiver needs to be even more forward-looking than it is currently framed. We need it for this pandemic for sure, but there are future pandemics, unfortunately, waiting in the wings. And what are we going to have, a 2.5-year process next time around too before something happens? How stupid can our species be if we don't fix this system now?
Thanks, Brooke. We have had a discussion about how stupid sometimes we can be, but let's not open that discussion here. Laurie, you have the last word before we close the event.
My colleagues have said it all. I don't have very much to add. There have been beautiful comments that are spot on by everyone who's gone in the sum up before me. And I would only say that in the face of that wisdom, in the face of that clarity, the US needs to follow through on the beautiful thing it did last May and exert the leadership to deliver this waiver in the short term in its arc of thinking about what changes to WTO are needed for the long term. And the Europeans need to get the hell out of the way with this immoral blockage that is going to go down historically as a blight, as the leading of the blight of pharma greed and the deaths it's caused during this pandemic.
Yeah, so thank you very much. I think we have had a very rich discussion. So I would like to really thank all the panelists, for participating and sharing. I think years of experience and expertise. I think we have learned a lot as to how the system does not deliver. We have been saying it before COVID-19. We have seen it up front. Unfortunately, we have had to see the so many deaths, right? The latest estimate, as I mentioned, is 18.2 million deaths and we hope that, I think we are at a point where we really need to do the right thing. And we are dealing with a lot of uncertainties, unknowns, mutating virus. And what is key is really for countries to facilitate recovery, to reduce the inequality. We really need that access to happen. And everybody should have that access in a very timely manner. It should be affordable. And I think this is what, at the end of the day, the TRIPS waiver is really about. It's also about building resilience for the future, because we can see there's a high concentration in production. And if we are going to deal with future epidemics, pandemics, we need to build resilience. And it cannot be, and we need diversified production. We need, and that is in everybody's interest at the end of the day. I think it's in the interest of the developed countries in particular, that different regions are able to address their essential medical needs, especially in times of a pandemic. So thank you very much to all the speakers, to the attendees for staying on with us. I wish you a very good day to all of you all. And we really hope that the points and the thoughts you have raised are heard with the WTO, those that are engaged in the negotiations, the US, the EU, the waiver co-sponsors and other members of the WTO, and that they will pick up, and we hope to see a meaningful solution at the end of the day. So thank you very much.